Herpes infection or HSV1 and HSV2. Do we have any solution for this in homeopathy? So today we will be discussing the same. Hello friends, I am Dr. Arpana. I am a homeopathic consultant. In this channel, I talk to you about the role and scope of homeopathic medicines in the various diseased conditions. Today we will be discussing about the condition herpes simplex virus, also known as HSV. HSV can be basically of two types, HSV1 and HSV2. HSV1 is generally responsible for lesions above the waist and HSV2 is responsible for the lesions below the waist. Although we see a lot of intermingling between the two as well. So we will be discussing in details about the same and also the homeopathic medicines which can help you. Do not forget to subscribe to the channel and hit on the bell icon so that you are always updated with all the latest information that I share with you all about homeopathy. So let's get started. HSV or herpes simplex virus. Now this herpes simplex virus is responsible for the lesions on the skin and the mucocutaneous parts of the body. HSV1 is generally responsible for the lesions in the mouth, in the oral cavity, and HSV2 is responsible for lesions in the genitals. Now this can be transferred from an infected person to a healthy person through the lesions or the blisters or the fluid-filled vesicles which is having the virus in them. But even the asymptomatic persons, those infected with HSV but they are asymptomatic, they do not have any blisters, they do not have any lesion on their body, but they can still be shedding the virus and they can infect healthy individual through their body fluids like the body fluids of the vagina or through the oral cavity. Now HSV1 and HSV2, the virus once they enter your body, they are going to stay inside the body. So what happens in the primary infection, so when a person is getting infected with the HSV1 virus, there will be fluid filled blisters which we can see in the oral cavity, the mouth, corner of the lips. In case of younger children or in case of the younger population, there can be symptoms of pharyngitis also along with this, fever. So this will be the general symptom or the primary symptoms of HSV. In case of the genitals, it can be again fluid filled blisters having some burning, tingling sensation, and then the blisters or the lesion, they can even get spread to the thighs or even the buttocks. Now after this, there can be reactivation of the virus on and off, and the reactivation can again be triggered by environmental factors like if your immunity is low, if you are infected already, then this virus can again like come up and show some symptoms, or in case of a female during periods, again this infection can trigger up. So the reactivation of the virus can happen due to environmental conditions. A person having HSV can be completely asymptomatic, still spread the virus. So HSV can be completely asymptomatic and still that asymptomatic person can infect another healthy person. HSV can also affect other parts of the body like the Herpeticwhitlow. So Herpeticwhitlow is a condition in which the nail bed is getting affected. So what is happening, if a person is scratching the affected lesion or the fluid filled blisters, then at that point they can potentially infect their fingernails or the finger bed, what we call as auto inoculation, and it could result in Herpeticwhitlow. Other than that, it can also affect the eyes, causing keratoconjunctivitis. There will be redness of the eyes, smarting, burning, watering from the eyes. And we see this particular tree-like appearance of the blood vessels of the eyes in the cornea, which is very peculiar to that of the HSV infection. Now once the virus enters your body, it is going to stay in the nerves, in the nerve plexus. So it can stay in the trigeminal nerve plexus, which is supplying the facial muscles, or in the sacral plexus, which is taking care of the thigh region, especially the posterior part of the thigh and most of the part of the legs. So the burning, the tingling sensation or the reactivation can be present in these areas. Now in rare cases, HSV can also affect the central nervous system. So in case of a pregnant female, the HSV virus can get transferred to the child during the process of vaginal delivery through the vaginal fluids. In the newborn baby, it can represent itself in the form of skin lesions, or it can represent itself in the form of like lethargy, dullness, in which it is affecting the nervous system. It can also result in seizures. If it is not treated or it is left untreated, then it can even result in like a disseminated form of the herpes, which can be a potentially dangerous condition leading to sepsis or even organ failure. Now these are the various presentations, or these could be the various presentations of the herpes simplex virus. Now herpes simplex virus, a person can stay with the HSV virus, but we have to find out like what are the triggering factor and why the reactivation is happening, and along with that the lifestyle has to be managed. So now coming to the homeopathic medicines. Now in homeopathy, we always consider the symptom totality of a patient, and accordingly the medicine is prescribed. So it is not advised to do self-medication, but you should always consult your physician so that the medicines can be prescribed accordingly. So some of the most common medicines that we used in case of HSV that I will be discussing with you right now. The first medicine, Natramur, a very good medicine when we see there are eruptions on the lips, on the margin of the lips, and this is kind of triggered when if a female is having the menstrual cycles. So that is the time when it can get triggered, then the medicine Natramur will be a good choice. The next medicine, Rhus. Rhus is a very good medicine for fluid-filled blisters, which is having intense amount of itching in that. So itching, fluid-filled blisters, and along with that restlessness. So the patient is very restless, he will just keep on moving from one part to another. So for symptoms like this, we can consider the medicine Rhus. Next medicine, Merc. Merc will be a good medicine, especially in case of children when we see there is lot of salivation, drooling of the saliva, and there is involvement of the lymph nodes or lymphadenopathy, then we can consider the medicine Merc. The next medicine, Sepia. Sepia will be a good medicine again for a female if there are menstrual irregularities or there are hormonal changes in the body, or maybe menopause. So during this time, if the female is becoming very lethargic, irritable, and there is reactivation of the HSV or even infection with the HSV virus, then the medicine Sepia can help. The next medicine, Graphites. Graphites is a good medicine when we see that there is moisture oozing out and there is dryness of the skin as a general, and generally in chronic cases in patients who are obese or overweight and they are having the problem of herpes, then we can consider the medicine Graphites. The next medicine, Petroleum. Petroleum is a very good medicine when we see that the eruptions, they are spreading to the thighs or maybe to the buttocks, and there is intolerable itching and there is kind of blackening of the skin. So in cases like this, we can consider the medicine Petroleum. So we have other medications also, again based on the symptom presentation of the patient, and accordingly homeopathic medicines can help. I hope you have liked the information that I have shared with you all about this HSV or the herpes simplex virus. So do not forget to like the video, share the video, comment, and of course subscribe to the channel and hit on the bell icon. If you wish to book an appointment with me, you can go to my website, that is DrArpana.com, and you can very easily book your appointment from there. You can also send a message in our office WhatsApp number. There also you will be provided with all the details for booking an appointment. Thank you so much for watching. Go to my YouTube channel for more such interesting videos, and we will meet again with another wonderful homeopathic video and the role and scope of homeopathic medicines.